Very good afternoon to everyone. Uh, Today my topic of study is Dermatosis Papulosa Nigra, a clinico-demographic study in a group of patients from Eastern India. And I am Dr. Mayukh Hazra, first year junior resident in Department of Dermatology, Venereology and Leprosy, Medical College and Hospital, Kolkata. In introduction, Dermatosis Papulosa Nigra is a benign tumor manifests as multiple benign small dark colored papules, occurs commonly in the dark skinned individuals. As this is quite common in occurrence, but the Indian data is sparse, hence I have chosen this study. So the objectives, coming to the aims and objectives, to determine the demographic profile and clinical presentation in of DPN in a group of patients from Eastern India. The study period was from September 2023 to January 2024. And the study type is an institutional-based cross-sectional study. The study population was patients attending the Dermatology OPD of Medical College, Kolkata. The sample size was 126, and the patients who didn't give consent or the age and sex criteria which was not matched were excluded from the study. Now coming to the methodology, the body mass index was measured, the age-sex matching was done, and we had put into the software for giving us the statistical results. Now coming to the results, the consecutive patients we examined was 1018, out of which DPN was found in 126, and the prevalence was found to be 12.37%, and the female outnumbered male by 3:1 ratio, and the age range or criteria was minimum 10 years and maximum 80 years. So in the individual of 21 to 14 mostly were affected. So if we see the age and sex group, so 21 to 40 was the most commonly affected. If we see the Fitzpatrick skin type, there is no any particular predisposition to any skin type, I would say, in the Asian skin types. In the pie chart, we can see the number of DPN. So most commonly was more than 5 number of DPNs, and the least common was a single DPN. Now associated systemic illness majority, that is 81%, didn't have any associated medical illness, but 19% had associated features, among which the most common associated systemic illness was hypertension, and the area affected was the most commonly the malar area. If we see other associated cutaneous findings, then we find that the 46% had acrocodone plus acanthosis nigricans plus obesity. So we can see the pictures of acanthosis nigricans, and in the second picture we can see acrocodone with acanthosis nigricans, and in the second patient also DPN was found. So if we consider the body mass index, so from our study we have found that there is significant correlation with the body mass index, that if we in the range of obesity to overweight, if we go, then it was significantly more. The DPN association was significantly more. In the discussion, the incidence of DPN among black person is variable, and in various studies it was reported between 5 to 50%. But in our study, we had found in between that only, that is 12.37%, from which we can conclude that the Asian population has predisposition to DPN. Now, as I said, with the analysis of the Fitzpatrick skin types, we couldn't find any specific skin type of Asian population that is associated more with the DPN. And sir, in the conclusion, I would say that DPN is a common benign dermatosis among the Asian race, most commonly found in the malar area. Till now, it was only considered as an aesthetic issue, but from my study, I would recommend to consider it is as a cutaneous marker for obesity also. And the limitations of the study were blood investigations were not done, and histopathology was not performed to confirm the diagnosis. It was just a clinical diagnosis, and more study population could have been included. These are my references. I would like to thank MCSA for giving me the opportunity to present on DPN, and I would like to thank our HOD, Dr. R.C. Khorami and Dr. Avanti Shah ma'am for guiding me during doing this project. I would like to end my slide by a thank you note and happy 190 years of Medical College Bengal.